So without further ado, I just want to take this moment to welcome Marie Cooper, who's the Senior Outreach Coordinator for the Health Benefits Exchange. And I want to just say um, so the hard news is then she's going to go through all this, but we have a lot of people who are uninsured in the state. And it's a problem for entrepreneurs who can't take care of their employees. They themselves have to stay on a job for health coverage, so they can't be fully engaged in their business. It's a huge problem. And we have the lowest uninsured rate in history, thanks to the work that Marie and her team are doing. And so last year, we were fortunate to do not one, but two programs with Marie. And she's incredibly knowledgeable. The programming is in so many different languages, so there's a lot of access barriers that they've overcome. And so I just feel so grateful that you're here again this year, because I know that the enrollment period begins in November 1st. So I also, just one more thing, they realized that focusing on business was a big deal. So 1 year ago, they hired Marie and had this increased emphasis on reaching small businesses and partners like all of you on this call, and that there has been an impact. So I'm going to leave that to Marie to share the good news there, but really it's been a tremendous collaborative effort, and I appreciate so much you being on the call. Go for it, Marie.
All right. Hi, everyone. Thank you. Thank you for having me again this year. It has been a great year. Last open enrollment, kind of leading it to what Lisa was saying, our uninsured rate is lowest that it has been in the state, which is wonderful. And we did see an increase in applications, 13% increase in applications last year. All the work that we've been doing together, all the, sharing our information of where small businesses can get health coverage has been working. Thank you so much for taking the time to hear the presentation and also share the information. I know that I can't do all the work on my own of reaching small businesses. I try to attend events, I try to attend, different things, but really I feel like you all as trusted advisors with small businesses and working with them, being able to share my resources with them is a key thing in reaching this audience. And we know this is a really important audience to reach. So I would love to just, kind of ask you, and maybe we can do an open dialogue really quick of, I guess, when working with small businesses, talking about healthcare, is that something that you normally ask with your, I guess, how you're interacting with them is, and you're coming up with a business plan? Do you normally ask them about their healthcare and if they have coverage?
Marie, would you like them to answer the question in the chat or verbally?
We can do, I don't know. It's always hard because I always want people to feel comfortable. Some people don't like coming off of mute. So verbally or in the chat, how people feel comfortable.
Marie, just to fill the space, my sense is it's not the first question asked.
Sure.
In doing small business interactions. It might come up in conversation, but it would have to be a longer conversation when you start talking about it, talent and employee retention and recruitment.
Okay.
But if folks have an answer, or if you want to just answer in the chat, that would be great. Keep going, Marie. And if you want to pull up your slide deck as well.
Oh, okay. I can share that. Yeah, I can do that as well. Great. Yeah. So, I mean, I think the biggest thing is, wanting to connect with small businesses, making sure that they're aware of their options on Washington Healthplanfinder, because really, most small businesses, I mean, I don't even want to say small businesses. I think most people are familiar with getting their coverage through their employer, right? Like they're like, oh, that's where I get my coverage, but they're not familiar with, you know, different options where they can get coverage. They also probably have some barriers where they think, the affordability, it's going to be really expensive. I always know health insurance is expensive. So, kind of really them knowing where they can get their health insurance is an important thing. Which actually, let me ask one question also. If anybody wants to share, I mean, when talking to them about health insurance, do you have any barriers, or are you hearing kind of a common thing that people are saying?
I think one common thing that I have heard is how flexible it is, how valuable it's for employees. Is it fit every employee, or is it just for certain employees? I was saying as a Latino community, like are the employees need to get a verification of status or for to get able to get health insurance?
Yeah, that's a great question. Yeah. Great. No, that is a question that we get, of like, especially different people's healthcare needs, different plans that they need, the amount of, that can vary between different employees, and making sure that you're offering, if it's an employer, offering a quality plan is important. So, and we'll cover that within the presentation. So thank you for sharing that.
And Marie, I'm not sure if you saw in the chat, Kateri from Sister Sky said, when we have one-on-one sessions, we focus on what they are asking for. However, when we do workshops, we mention insurance at least 3 times throughout the workshop to plant the seed.
Oh, thank you, Katir. That's wonderful. Awesome. Yeah, I know it's a limited amount of time, especially when working with a small business. They're super busy. They're wearing multiple hats. So to be able to cover every single thing is really difficult. So, well, I'm happy that I'm here today, and I can share some information with you about us. And if you do go down that conversation where maybe you run out of time, you could always share my information with them, and I'm happy to kind of talk to them about the different options. But this presentation, I mean, is really timely. Open enrollment is right around the corner. So it starts November 1st. So I did want to share some information about Washington Healthplanfinder, and how you can support your employee, how you can support the businesses you're working with. So, all right. So let's see, is it advancing? Okay, great. So if you're not familiar with Washington Healthplanfinder, I'm just going to give you some background information. So I'm with the Washington Health Benefit Exchange. We operate the state's official online health insurance marketplace, Washington Healthplanfinder. And this is where Washington residents can shop, compare, and purchase high quality health and dental insurance. It's used by 1 out of every 4 Washingtonian. And it's used primarily by people who are not being offered employer-sponsored health insurance. So people who are self-employed, employees of a small business who, again, aren't being offered employer-sponsored health insurance, those that recently lost employer coverage. So maybe they experienced a job loss. We know there's a lot of layoffs that are currently happening. This is a way for them to bridge the gap before they get to the next job. Also, it's a great alternative for those who may be even offered COBRA coverage. We know COBRA can be expensive. This is a great alternative for them to get coverage. Participate in the gig economy, work seasonally or part-time. And then also those that do not yet qualify for Medicare. So if you are working with maybe some small businesses who retired early and they're like, now I'm ready to do my passion, but I'm not able to get that Medicare benefits, this is a place where you can tell them to come and look at different plans. So I have health insurance. I think we all probably on this call know the importance of health insurance. For a small business owner, it's really important for them to have this on their radar, because as small businesses they're doing probably 5 jobs sometimes. They're everything, especially as an entrepreneur who is just starting out. And so their health is really important. Having health insurance allows for them to get, preventative care to stay healthy, and then also to be able to get medical assistance when they're not. It also makes those healthcare costs manageable by sharing into the cost of whatever services they seek. So in supporting their employees in finding health coverage, you know, this, and I use the word support because for different small businesses, that can look different for them. Not everybody's able to afford a group plan right now. They're either not meeting the participation requirements or it's really not affordable for them at this time. So support can look different. And we'll talk about that, but being able to have some sort of plan of how they can offer their employees benefits can help in retaining and recruiting valuable employees, and then also allows for their employees to get the preventative care to stay healthy as well, and seek services when they're not. So this can also lead to less sick and workday absences for their employees and lead them to be more focused and effective at work. So really able to reinvest into their business if they're coming in feeling healthy on a daily. So there are a lot of different options for small businesses. So small group plans, that's what everybody is for the most part familiar with. This is when you get your coverage through your employer. Usually the employer offers like 2 plans for them to pick from. Individual plans is another option. So this is what we offer through Washington Healthplanfinder. So we don't offer group plans. They are all individual plans. We call them qualified health and qualified dental plans. These are owned by each individual. So the employer would have one, the employees would have their own, but they're not connected. Health reimbursement arrangements and health savings accounts, these are different options. It's not actual health insurance, but it is a way for an employer to be able to assist in paying for part of either their premiums or medical expenses. So I'm going to dive in deeper in just talking about Washington Healthplanfinder and when this would make sense for a small business. So as I've mentioned, through Washington Healthplanfinder, they are not able to get a small group plan. All plans on Washington Healthplanfinder are individual plans. So this would work really well for small businesses that are maybe 5 or less employees, small businesses that struggle to meet the minimum participation requirements for the number of employees that need to be on that group plan. And then also there is a requirement where with a group plan, you have to pay 50% of the employees' premiums as an employer. Sometimes that can be a struggle for a small business. So this is a way for them to, if that is a struggle for them, to find coverage for themselves and then support their employees in getting coverage by telling them where they can go to get quality coverage. I did say, so I should probably back up and say, it works really well for like 1 to 5 employees. I mean, really, it doesn't necessarily need to be 5 employees. I mean, I have spoken to nonprofits who say they just have limited resources and they have more than that. They want to help their employees in finding coverage. They aren't able to offer a group plan. They have a lot of part-time employees, this also can be an option for them as well. But if we're looking at kind of like a small business, usually if they say they're under 5 employees, this might be an option for them. So, okay. So individual plans and small businesses. So with an individual plan, again, it's all owned by the individual. So there's no minimum participation or contribution requirements. There's a flexibility of plan options. So Veronica, how you were talking about, different employees may need different care. There are multiple plans on Washington Healthplanfinder. There's 90 plans. The nice thing about coming here to the state's marketplace is that there is multiple different carriers all in one place that allow for the customer to be able to review and compare the different plans between different carriers all in one place. So if they have employees that, one needs more, maybe is okay with a higher deductible because they rarely go to the doctor, they can get a plan that fits their needs, as opposed to maybe somebody who, they see the doctor regularly, they have medications, they need that extra care. They're able to find a plan that fits their needs there. It's again owned by the individual. For some small businesses, having to manage a group plan is just something that they just don't want to do. They're wearing multiple hats. They're doing different things. That's just not something that they have the time for. So it kind of frees up time for the owner. It really is just saying, hey, sharing, this is where you can go to get coverage. As they know, looking for health insurance can be really difficult. So supporting them and showing them where they can go to get a quality plan is a way of supporting them. This is also available for part-time and seasonal employees. So if you have any businesses that you're working with who say that they have a lot of seasonal employees, part-time employees, this is where they can go to get coverage year-round. Most likely also, if they are part-time and seasonal, their income may be probably lower, and they may actually qualify for some subsidies, so federal and state subsidies that can help lower their cost of insurance. And we'll talk about that coming up. Okay. So on Washington Healthplanfinder, again, you can get qualified health and qualified dental plans that fit your lifestyle. This is the only place where they can get access to federal tax credits and Cascade Care Savings, which is our new state subsidy that can lower their cost of insurance. So that's really important. So as opposed to going directly to a carrier, say, if they are eligible for these subsidies, they wouldn't have access to them if they went directly to a carrier. So that's kind of the importance of them coming through Washington Healthplanfinder, because if they're eligible, they can get access to them. This is also the place where Washington residents can apply or determine eligibility and apply for Washington Apple Health, which is Medicaid in our state. All right. All plans, when I'm saying they're quality plans, they all offer the 10 essential health benefits. So they offer prescriptions, preventative care, mental health services, pediatric care. Nobody's denied coverage because of a pre-existing condition or rated on that. All right, so the cost of coverage. So when they fill out the application, if they mark that they do want to basically scan for or look if they're eligible for financial assistance, they will go through all of the financial assistance programs that we have on our site. So again, so if they're eligible for Medicaid and they click that, it'll tell them that. If they aren't eligible for Medicaid, they don't have to say, I want to enter into, fill out a separate application to see if they're eligible for Medicaid. It'll scan through all of it. So once they fill out the application, they'll get that eligibility determination. If they're eligible for Washington Apple Health Medicaid, it is free or low cost. For those that are eligible for a qualified health and qualified dental plan, those prices vary, and that's based primarily on their age, their household income, and then the county that they live in. And I should probably also add in household size. That does make a difference as well. That's because these are the main factors that determine the amount of financial assistance they may be eligible for, and then also what plans are available in the area. So you can see that we do have people who are receiving premiums that are $10 or less a month. And this is people who are not eligible for Medicaid. So they're above that threshold for Medicaid. 43,000 people who are having premiums of $25 or less, and 83,000 people who are having premiums of $100 or less. So most likely these people, especially people who are receiving premiums $10 or less, are probably eligible for our federal tax credits and Cascade Care Savings, that state subsidy. All right. So just to give you some information about Cascade Care plans and Cascade Care savings. So Cascade Care savings, so that's that state subsidy that we were talking about. So this is the a state funded subsidy that can help lower the cost of those qualified health insurance. So that is for people who earn up to a certain income. So they base it off of the federal poverty level. So it's people who are under 250%, which, I mean, who knows what that is? So we have this chart here. So as you can see, like a person who's a household of one, the max amount they can earn per year is $33,975 to qualify for this program. So this is people who, again, are not eligible for Medicaid. They're in a qualified health, qualified dental plan, but they're eligible to then receive the additional state subsidy in addition to that federal tax credit. So it wraps around those federal tax credits. Then other thing that's really important about this program is that those that are eligible for this as well, this program, they are eligible for a special enrollment period outside of the regular enrollment period. So say it's April and you're working with somebody who it's outside of open enrollment timeframe. They can see if they're able to enroll outside of the open enrollment timeframe to get coverage starting sooner if they qualify and within this household income. Okay, so this is only available through Washington Healthplanfinder. This table does update every year because it follows the federal poverty level that's set by the feds. So this will likely increase or change, but did want to point that out. All right. So our Cascade Care plans. So these are our high value plans. If you do go down the road of like looking at plans with them or just exploring the site and you were curious, I wanted to point out our Cascade Care plans. So these are high value plans. They have lower premiums. They have lower co-pays. They are available in all counties by all carriers. For people who are eligible, who show that they're eligible for Cascade Care savings, also an important thing is they do need to actually enroll in a Cascade Care Gold or Silver plan to actually have those savings be added and are deducted from their monthly costs. All right. So when can they sign up? So Washington Apple Health, they can enroll year round. So it doesn't hurt for these, these entrepreneurs, if you're working with them, to really come in and fill out an application any time of year to see if they are eligible for either Cascade Care Savings or Washington Apple Health, especially if they're saying, I really need coverage. They can come in and see when, see if they are eligible for those and can get a special enrollment period or qualify for Medicaid. For qualified health and qualified dental plans, so you typically have to enroll during fall open enrollment. So that's coming up starting November 1st, goes until January 15th. However, for someone enrolling to receive a January 1st start date, they do need to enroll by December 15th. So that's important to know. So the deadline for them to receive a January 1st start date is December 15th. Any enrollments after that will receive a February 1st start date. There are ways that they can enroll outside of open enrollment, but they do need to experience a qualifying life event. Some examples of that, there's a full list on our site, but loss of employer coverage is one of them, move to Washington State, if they're eligible for Cascade Care Savings. So they typically have 60 days before or after the date of that qualifying life event to enroll. So there is a deadline. So if they lost employer coverage, their employer-sponsored health insurance, and it ended September 30th, they have from the end of September 30th, so starting October 1st, 60 days after that to be able to enroll into coverage. These are the carriers that are currently on our platform. This may change for the 2024 plan year, but just to kind of give you an idea, when I was saying it looks at different carriers and compares, and they can compare different plans with different carriers all in one spot. These are all the carriers that we carry. Okay. All right. This is our official website. There are lookalike sites out there. So it is, I always like to just kind of show this just so you know you're in the right spot. We also have a mobile app that they can download. Two things I want to point out on our home screen is our browse and compare plans tool here. So this will allow for them to go in and get an estimate of the financial assistance that they may receive, and then also look at the plans that are available in their area. So it takes real basic demographic information when they do this estimate. So it's not the most accurate amount, but it kind of gives them an idea of kind of how our system works. If they want the most accurate amount of financial assistance that they're going to receive, they actually will want to fill out an application. Filling out an application doesn't require for them to actually have to enroll into coverage on Washington Healthplanfinder. There is a stop that shows eligibility results, and then they can review plans, but it doesn't mean they have to come in and actually enroll in coverage. So, all right, when they're reviewing plans, you know, our system is set up to be self-serve, so they can come fill out the application, look at the plans themselves, pick a plan themselves if they'd like to. There is a online decision support tool that will kind of pop up on their screen, and it's called Healthplanfinder. So if they do have specific like medical needs, like certain prescriptions, or they like to see certain providers, this will kind of help them put that information in and then filter through the plans that are on our site. We have a lot of plans. Currently we have 90 plans on our site. So that could be kind of overwhelming for some people. So it really will kind of narrow down that search for them. All right. And as I mentioned, our site is, or the application is set up to be self-serve, but they don't have to fill out the application themselves. We have free enrollment assistance available statewide. So if they need assistance, if they feel more comfortable talking to somebody through filling out the application from beginning to end, or, you know, with, you know, different populations, you know, there may be language barriers and they may need assistance and like to speak with somebody in their preferred language. Our customer support center offers language assistance in 200 different languages, but also our navigators and our brokers, they do offer, you can also search for a specific language that they may need assistance in as well. So that's an option as well. We do have different enrollment centers as well across the state that can help people enroll as well. But they really are there to compare plans, to help them pick a plan, to help them answer any financial assistance questions, fill out that application. For a small business owner, there might be questions on how they fill out their income. That may be a huge thing for them. They're like, well, my income is this much this month, but then this much this month. So how do I kind of figure that out, and how am I putting that in? I would recommend that they do talk to one of our sisters, maybe one of our navigators or brokers, to kind of figure that out, to make sure they're being as accurate as possible. The biggest thing is that with their income, they want to be as accurate as possible, because if they are eligible for any federal tax credits, if they are not reporting their income correctly and under-reporting their income, especially significantly, when they reconcile their taxes, they may be required to have to pay some of those tax credits back. So that is an important thing, that they make sure that they are, you know, doing that correctly. Okay. So this is coming for our 2024 coverage year. So starting November 1st, and I don't have a ton of information on this, but starting November 1st, like open enrollment, those without a federally recognized immigration status will be able to come to Washington Healthplanfinder and be able to enroll in a qualified health and qualified dental plan. So these are for people, or our goal was to be able to increase health insurance access to all Washington residents. So even those people who are undocumented, this population, because of the Affordable Care Act and what the how we were created, they are not eligible for federal tax credits. However, they are eligible for Cascade Care Savings, that state subsidy that can lower their monthly cost of insurance. So there is some assistance that's available. Now, we know that those that are this population may possibly need more financial assistance. They may actually qualify for Medicaid. So that program is also, there is also a Washington Apple Health expansion that is coming, but that doesn't come until July 1st. So the thought though is that we wanted to make sure that we were able to offer something. So the qualified health plans are available starting for them to enroll starting November 1st. Their coverage would start depending on, if they enroll before December 15th, their coverage would start January 1st. They may be eligible for this Cascade Care Savings to lower that cost. But if you are talking with some businesses or employees that are falling under this category, and they're saying, it's still unaffordable, this is too expensive, let them know that, starting July 1st, that the Medicaid expansion will be coming. And we know that, let's see, like 36% of uninsured and undocumented in Washington state have an income that fall under that Medicaid expansion. So it's coming, but again, we just wanted to make sure something is available if it's definitely needed. Okay. And then I believe I don't have my chat open. I'm sorry if people are asking questions. Thank you. Okay. So Cherie put in, so we recently had in September a webinar. Cherie had put that webinar in the chat. So it's on our YouTube channel. Feel free to check that out to learn a little bit more about this program that's coming down the pipeline if you're interested. Okay. And then again, just reiterating, the important dates of open enrollment. And then my services. So I know that like working with small businesses, I mean, it sounds like you guys are all giving them a lot of information. They're really busy. So if, my role isn't to tell them that this is the program that they should be in. They should be getting coverage through an individual plan on Washington Healthplanfinder, or you should be in a group plan. That's really not my role. My goal is to really provide them their options in an easy, digestible way. So if you are working with some small businesses and you do talk about health insurance, feel free to provide them my information, or if they ask about it and you don't feel comfortable answering those questions, feel free to provide my information. I'm happy to talk to them about what options that are available to them. I'll talk to them about individual plans, group plans, HRAs, HSAs, and what that would look like for their business. And then I provide them the resources so they can get the coverage that best fits what their needs are. I also am able to do employee presentations or provide informational handouts. If those need to be translated into a different language, I can request to get that done as well. I also am able to connect them to one of our brokers in our enrollment center. So if you're working with a small business and they do know they want a group plan, I can connect them to a broker that is able to assist small businesses with group plans. If they have gone down the road of looking for a broker, they may have found that it can be really difficult to find a broker that wants to work with a small business. The nice thing about these brokers is that they're certified on the exchange as well as certified to sell group plans. So they really are able to compare and dive in deep of like, what is the best option for you after I provide them the information of like the different options. They can really dive in and look at, for their business, for their employees, what options is the best option for them. They are also able to talk to them really knowledgeably. Some are even administrators of HRAs and HSAs, so they're able to assist as that as well. So I'm able to connect them to a knowledgeable broker to be able to assist them as well. And then, to get access to these, if this is the small business email inbox, I'm in the inbox, so it'll probably be me that talks to them. You can feel free to provide them this email address and I'll make sure to reach out to that a small business. So. All right. That is, I mean, for the most part, everything. Is there any questions?
There wasn't one in the chat, Marie, that I don't think has been answered. Steve Burke asked a few minutes ago about age. Turning 26 considered a qualifying event?
If they're turning 26, Steve, because that is kind of the time frame when they are aging off of their yeah. Okay, I saw your thumbs up. Yes, so they're losing their parents' coverage. So they're losing coverage. So this would be a qualifying life event for them to come and enroll. Yeah. So usually, typically, you age off of your parents' plan at the age of 26. I think is what Steve was getting at. This would be a qualifying life event for them. Mm-hmm.
And if you have other questions, don't hesitate to unmute yourself. We've got a few minutes here, or post them into the chat. I'm looking. I think this has been really helpful. And Marie, you're really good at making it understandable. And obviously, just a fundamental priority for workers, and workers need to be a fundamental priority for small businesses. So thank you very, very much. Last call on questions or comments. Lots of thank yous to you, Marie. And then I'll just open the floor if there's any other resources that folks want to share, or challenges you're having with a client, any other sort of for good of the order for today. Well, maybe we will call it there. Marie, thank you so much for all that you do in these complex state agencies. It's extremely helpful for us, even if we don't have a question today, to know that we have a person who understands the role that we're trying to play and the power of our trusted networks. And we're here for you. So I hope you will continue to lean on us. Cherie, if you could pass along to Lisa how much we appreciate this program and all that WSMA does for this team and for small businesses across the state, I'd appreciate it.